I am here to talk about my very favorite thing, the pelvis. The reason is because every single patient that I adjust typically has a misaligned pelvis, and they always ask me why. Why do I have this? Is this abnormal? It is the most common thing for me to treat on a daily basis. And the biggest problem, the biggest reason that they misalign is from the back of our body being super tight. Our hamstrings and our glutes get really tight and we don't realize that, and that's what pulls our pelvis out of alignment. And whether you're a good stretcher or not a good stretcher, whether you stretch sometimes or never, even if you are a good stretcher, you typically won't push yourself to the point where it hurts. You'll stop right before that, like, oh, I stretched enough, let's move on. And then people that just don't stretch at all, it's typically because it hurts and they don't want to even go there. So what I highly recommend then is obviously to get adjusted, but to help keep your pelvis aligned for a longer period of time and not just rely on adjustments would be to get a deep tissue massage for your glutes and your hamstrings. So when people come in, I'm like, don't get a deep tissue on your lower back. That's not exactly what you need, even though you might feel like you need it there. It's typically the culprit, the root cause of the pelvis misalignment is the tight glutes and hamstrings. So see one of our deep tissue massage therapists and have them just dig into your glutes and your hamstrings. They're used to it. We need that because we're not going to do it on our own. We just stop and we're like, I don't want to foam roll it. I don't want to stretch it. It's really uncomfortable. So just have us do it for you, and then you don't even have a choice. I really highly recommend Amanda and Bethany. They are our deepest tissue massage therapists. They will get in there. They will lighten up if you need them to, but they will really be a really effective massage. You know, it's not one of those, let's just go and relax. We need something to actually help us get through this so we don't have this recurring issue and we can keep working out, sitting, walking, and doing all the things we like to do. If you're not sure how bad the damage is, there is a good self-check I'm going to show you that you can do at home to check your own pelvis to see how you are. So what you can do is stand up if you're sitting down, and you want to just stand somewhere for about 30 seconds to a minute, and it should feel normal to stand equally on both of your feet, like by your heels to your feet. If after a little while you're like, oh, this doesn't feel comfortable, like my back is starting to kind of bother me and I want to just bend my knee, this feels so much better, then you know you're misaligned. And the reason is because when your pelvis goes out of alignment, one leg will become longer, and then your right leg, say your right leg's longer, your left leg's not going to float around in the air, it's going to go down, and then your right leg that's longer is going to push up, and then it's going to make this discomfort that you're having in your lower back. So how you can just check, see if you need to bend your knee. If you do, then you're misaligned.